You might wake up exhausted after a full 8 hours of sleep. You might notice extra hair gathering in the shower drain. Or maybe you're looking closely at a tiny paper cut, wondering why it's taking so many weeks to heal. The standard reflex is to blame these frustrations on the inescapable noise of modern life. We write them off as the natural result of stress, getting older, or a few bad nights of sleep. But the human body operates a continuous diagnostic system. It is constantly transmitting critical physiological signals about its internal state, even if we lack the vocabulary to decode them. Every day, seemingly minor physical changes are frequently the very first indicators that your body is running out of an essential nutrient. Dismissing these specific changes as mere stress means leaving them untreated. Over time, those minor, microscopic deficits quietly compound into major systemic failures. Let's look at one of the most common diagnostic signals: persistent, unexplained fatigue, particularly when paired with unusually pale skin. At the center of a red blood cell is iron, the critical molecular linchpin required to produce hemoglobin for transporting oxygen. When you run a deficit of iron, this hemoglobin lattice collapses, oxygen transport fails, and the body essentially suffocates on a cellular level. However, iron doesn't work alone. Vitamin B12 is equally critical for the creation of healthy red blood cells. A B12 deficiency deprives the cells of their structural components, producing the exact same circulatory signals of heavy exhaustion and paleness. This is where we encounter diagnostic noise. Fatigue is the single most ambiguous signal the body produces. It can be triggered by dozens of entirely non-nutritional causes. While exhaustion is a vital alarm bell, jumping straight to the conclusion that you have an iron deficiency without laboratory proof risks blinding you to other, potentially severe systemic diseases. The alarm system also monitors your physical structure. Sudden hair loss, brittle nails, weak bones, and abnormally slow healing wounds are clear signals of structural decay. Maintaining bone density and muscle function requires calcium, but the body cannot absorb calcium without an adequate supply of vitamin D. Here, a microscopic view shows collagen fibers building a structural scaffolding to close a wound. Synthesizing that collagen requires a strict supply of vitamin C. An inadequate supply halts the scaffolding process mid-construction. Without necessary binding elements, biological tissue cannot repair itself. But structural decay signals overlap heavily with other medical realities. Poor wound healing and thinning hair are frequent markers of genetic conditions, hormone imbalances, and circulation-inhibiting diseases like diabetes. Assuming a brittle nail or a lingering cut requires nothing more than a simple vitamin fix can dangerously mask a much larger genetic or hormonal malfunction. Then there are the neurological signals: frequent sharp muscle cramps or unexplained tingling and numbness in the hands and feet. A severe vitamin B12 deficiency actively degrades normal nerve function. It damages the communication pathways, causing these erratic physical misfires and that distinct numbness in your extremities. Yet again, there is competing diagnostic noise. Specific medications and chronic alcohol use damage these exact same nervous system pathways. Tingling extremities are a severe physiological warning sign that should never be ignored. Because the nervous system is highly complex and easily damaged by external factors, these symptoms demand professional medical evaluation rather than blind guesswork. When people finally notice these physiological signals, the modern behavioral reflex is to self-diagnose and immediately purchase high-dose, isolated vitamin supplements. This chart shows the biological flaw in the quick fix strategy. The body requires a consistent nutrient stream to stay within an optimal absorption zone, not massive doses. Mechadosing fat-soluble nutrients exceeds the body's processing capacity. Instead of flushing out, the excess accumulates, becoming toxic. The true solution for maintaining biological consistency is straightforward. Eat a balanced, nutrient-dense diet containing whole vegetables, grains, legumes, and quality proteins. The smartest response to persistent physical alarms isn't playing doctor. It's providing your body with consistent, high-quality fuel and letting medical professionals use laboratory testing to find the one true signal hidden in the noise. Which health warning sign have you noticed recently? Let us know in the comments.